we are going to look at infections affecting the nervous system. The following are the infectious disease or infective disease that affect the brain and the spinal cord. Meningitis, poliomyelitis, encephalitis, rabies infection. We are going to look at meningitis. What is meningitis? Meningitis is an acute inflammation of the protective membrane covering of the brain and the spinal cord. Acute inflammation of the protective membrane covering of the brain and the spinal cord. What are the causes? The meningitis can be caused by virus, bacteria, protozoa, malaria, in case of cerebral malaria, amoeba, and so on. The pathophysiology. The brain and the spinal cord is protected by a covering. This covering serves as a blood-brain barrier. Blood-brain barrier, that is a covering that does not allow exchange or movement of blood into the brain or the spinal cord. It prevents the movement of brain from reaching the cerebrospinal fluid. The brain is constantly bathed with fluid called cerebrospinal fluid. When there is inflammation of this meninges, or when there is infection in the blood, infected blood is conveyed to the meningeal surface. This now results to the mobilization of white blood cells for a defensive activity. The white blood cells now respond in regard to the microorganism in the circulation, resulting to autoimmune response, which lead to inflammation. This inflammation allow the organism, when the organism overpower the white blood cells, the inflammation now affect or infect the fluids, and this now result to the following signs and symptoms. When there is inflammation of the meninges of the brain and the spinal cord, it results to the following signs and symptoms. Severe headache, nochial rigidity, that's inability to flex the neck due to increased neck muscle tone. The patient may not be able to flex the neck, or there will be neck stiffness. Another one is fever. The temperature when it is checked is above 38 degrees centigrade. altered mental status. The patient may have loss of memory, loss of consciousness, loss of concentration, photophobia. Patient may be having intolerance to light. He may also have intolerance to loud sound. Small children may appear irritable and the fontanelles can bulge. That's at the age at 6 months. There is a positive carnic sign. Positive carnic sign. This is when the patient is lying with a thigh flexed on the abdomen. The leg cannot be completely extended. Positive Brudzinski sign. When the patient neck is flexed, flexion of the knees and the hip is produced. There is seizures. Then we have diagnostic investigation. Presenting clinical sign is very important in diagnosing meningitis. Physical examination, lumbar puncture, blood test, example, white blood cell count, erythrocyte sedimentation rate, CT scan and MRI can be done. Medical management. Medical management. When the meningitis is caused by bacteria, or if it is caused by bacteria, antibiotics such as penicillin, crystal penicillin, and corticosteroid may be drug of choice. If it is viral infection, there are some, if it is viral, example, when it is caused by herpes simplex virus, drugs like acyclovir may be drug of choice together with analgesic. If it is caused by fungal infection, in case of fungal meningitis, flucytosine or amphotericin B may be given as drug of choice. Dehydration and shock are treated with fluid volume expander like normal saline. Nursing management. Assessment of neurologic status and vital signs is very important. Prescribed oxygen may be administered. Prescribed drugs such as antibiotics, depending on the cause. Prescribed corticosteroids. Prescribed normal saline may be given. The patient may have some form of anxiety. The anxiety may be allayed. Assess the neurological status of the patient. Protect the patient from injury secondary to seizure activity and altered level of consciousness. Prevent complications associated with immobility such as pressure and pneumonia. Institute infection control precaution until 24 hours after initiation of antibiotic therapy. When the patient is having oral and nasal discharge, inform the family about the condition. The complication of the disease include seizure, difficulty in walking, brain damage, headache, loss of hearing, visual problem, shock. Prevention of meningitis. Careful hand washing regularly. Avoid sharing toothbrushes, lip balm, eating utensils, straw with other individuals, especially those known to have meningitis. Maintain a healthy body state and immune system by exercise, eating healthy diet, covering mouth with clean handkerchief while coughing or sneezing. Ensure being vaccinated. Short-term antibiotic prophylaxis can be used in patients at risk of skull fracture. Thank you for listening. In the next class, we are going to look at encephalitis. Encephalitis. Thank you.